Namaskar friends, Jai Hind, and I am Deeptisharma Joshi on behalf of Global Healthcare Medi Talk Show in California Live TV. Again, I would like to welcome all the viewers and all the doctors. Doctor, today we are going to introduce a most eminent and renowned doctor of Goa, Panjim, Dr. Digambar Naik. Dr. Digambar Naik is a cardiac metabolic physician. Welcome, doctor, in the
Thank
studio.
you, thank you.
Dr. Digambar Naik is awarded at Rashtrapati Bhavan by the President of India. He got a Lifetime Achievement Award from World Congress of Clinical and Preventive Cardiology. Sir has also operated on Vocational Service Leadership Award from Rotary International and many more. And also he has got several awards from IMA. So, doctor, this is the award. You have got plenty of awards, international, national. You have awarded at many places, also by the President of India. And now I would like to ask you that you have written a book on alert, active, and alive at the age of 100 years. So, please give me a glimpse about this book.
Thank you, Deepa. Thank you so much for such lovely words. Okay. First of all, let me tell you, whatever I'm talking is science. Okay, it's my research onto that. And fortunately, unfortunately, many of these words appear a little bit closer to spirituality. And what is the spirituality? Spirituality is some on in health are some old words written by our senior people a long time back, 500 years back. And what has happened with that is after that, the Europeans came in between, and India was almost wiped out from the face of the earth, where we lost most of our research, especially on the health part of it. Okay. Now, if you see that spiritual words, no, that those few words which are written, that was a real medical research. Okay. In between, we lost that, but now I think we should be back onto that track again. Because if I look at the health today, the way we look at health, the way we treat patient with nothing in our hands, with no much facilities with the patients, we are still giving them great medical results. If you look at when we got independent, our life expectancy was 27 years. Today, the life expectancy is 70.8 years. Did we spend this much? No, we have got a very small part of GDP being spent on the health. I think we spend a minimum on the health. India has been labeled as a country of diseases, country of diabetes and heart attacks and all that thing. But really, if you go to see, our people have started living well. And if it was this book of mine was published in 2010, it has been reprinted 4 times, so it's a very highly selling book. But it took me almost about 8 years of a very strong research to work onto that book. 8 years. But when I wrote that book today, and I'm surprised myself. Today I want to put in the new thoughts and new thing. But then when I see that book again, every time it goes for reprint, whatever words have come inside it do mean the health, my friends. Do mean the health. We are actually born to live for 100 years onto this paradise called earth. Earth is the heaven for us. Perhaps we did something great in our previous lives, and then we are into this earth, onto this earth for as a gift to be on the heaven for 100 years.
Yeah, doctor, thank you
Yeah.
for guiding us. And as we all know that all sickness are a process of inflammation, and it is only the type of particular inflammation that will decide the sickness we suffer. So I just want to know the root causes of the disease as a clinician, as a cardiologist, as a renowned medical professional. You know the causes, and please give a glimpse on that.
We have simply we have to see it in a situation like this in a country loaded with people, a bit of pretty dirty country. Infective diseases are a big problem with us. If you look at the infective diseases, rest all of them, I would put them as a lifestyle disease, including, of course, like when we talk about lifestyle disease, we only think your hepatitis, your hypertension or diabetes or heart problem or stroke are the lifestyle diseases. No, your cancer is also a lifestyle disease. Most of our diseases are lifestyle disease. Infected diseases we easily are able to control. Malaria we have control, HIV we have control. Most of the other diseases we have, syphilis we have control. Sexually transmitted disease, infected diseases we have managed to control so beautifully. It is the our problem today is the lifestyle disease, which easily means we get a disease because we do not know how to live a proper lifestyle a man or a woman is supposed to be living. We are human beings living up to year 70, 80 years, but still I'm surprised to see we do not know how we are supposed to be. Suppose all the animals must be living in the right perspective. I don't know how they're going to, I'm not an animal doctor, but definitely we as human beings do not know what exactly we have to live. See, finally, we are very simple. You are exactly what you eat, because every day a few million of our cells die and they need to be replaced. For that, they need nutrition. And that nutrition will come from our routine food that we take. Okay, so this is the first thing. And if we learn to take the food correctly in the right proportion and the quality and the quantity, there is no need, we can be absolutely healthy. So we are exactly what we eat. Now, if you look at our body is made up of 50 trillion cells, and we have 300 trillion organisms lying inside our growing inside our body, in the intestines, in the another tract, ENT, and all other tracts. Almost 300 trillion organisms consisting of viruses, fungi, and bacteria. And you'll be shocked to see it is the balance of these that decide your health. It is the balance of this. So we must be, and all our cell, each of these 50 trillion cell is an individual by itself. Okay, that cell, we have so many functions. Each of the cell has its brain, each of the cell has its digestive system, each of the cell has its reproductive system, each of the cell has its your excretory system, and all that we perform. Each cell is an individual cell, and we are a colony of these 50 trillion cells. So we never live alone. We live into that colony. We live together. We live comprehending to each other. And that's where the whole scenario lies. And being each of this cell, you need to maintain that. Each of the cell becomes a machine. When you buy a machine, you have a maintenance contract for that machine. You regularly maintain that machine. I know how well we maintain our CT scans and you have the ultrasounds and all other units. Okay, we spend so much in that maintenance. The body also needs regular maintenance. Each of the cells need regular maintenance. And that maintenance is the exercise. So second thing, after what I say, we are exactly what we eat, we are exactly what we exercise. So all these cell needs exercise. Your brain, your it is not just your muscles or joints that need exercise. It is not just your chest that need exercise. Your brain need exercise. Your skin need exercise. Your chest needs exercise. Your lung need exercise. Abdomen needs exercise. Every organ needs exercise. So when you come to exercise, exercise is not just going into the gym and pounding yourself there, not at all. Exercise is that movement or that sort of thing that we need, where every cell is maintained as its own self, maintained in its perfect shape. And once we understand what do you mean by exercise, I think the rest is simple. And the third most important thing, ours is a colony of 50 trillion cells. This need to be maintained properly. For this, you need a government. And what is the government for human body? Is your mind.
Mind,
Your
brain.
conscious mind with which we are now working, and a subconscious mind. Okay. Most of the time, we are working on subconscious mind. It's only when we are awake, when we are doing a program like this, we are working on conscious mind. Subconscious mind, let me tell you, develops right from the time we are in the mother's womb to the stage where we are up to 7 years of age. At that time, our brain is in theta stage. It is at this time the full subconscious mind is developed. At the age of, say, 7 years, theta stage goes and we start getting alpha, beta, gamma stages subsequently into our brain. And from that onwards, we are no longer able to add to the subconscious mind. Subconscious mind stop itself from developing right from the mother's womb to the age 7. So whatever we develop is already fixed as a program on this supercomputer at the age of 7. And whatever we do after that is very little work, like learning a car and all. We do develop something, but not to that level. कारण when you जब आप subconscious में mind में रहते हो up to age 7, your ability to learn, if you take a small kid, the kid's ability to learn is 40 million times stronger than our ability. एक बच्चा जब पढ़ता है, इसको 3-4 साल के साथ बाद वो अपना फैमिली में फिजिशियन फैमिली मेंबर बनता है, तो उसने इतना पढ़ा हुआ होता है. Okay, and that learning capacity at that time is 40 million times than the capacity to learn that we have today. So it is at that time the whole subconscious mind is developed. And you know, when I talk about subconscious mind, what is the strength of the subconscious mind? Subconscious mind is 40 million times stronger than your conscious mind. And if you look at your whole mind together, conscious mind is 5% and 95% is subconscious mind, with an ability or strength of 40 million times stronger than the subconscious, than the conscious mind. This is the stage, and this is what we need to change. This is what we can. Fortunately, today, so once your subconscious mind is developed, your attitude, your habit, whatever you are will be sealed. But fortunately today, I worked it on my own and changed my own body. Fortunately for us today, science tells us how we can rewrite or reprogram our subconscious mind. It's not easy, but it is possible. And if we do that, we are back to whatever we want to be into this world, my friends. Living 100 years is just a gift which is there inside of us. We just have to activate it by properly understanding how do I live my life, by properly understanding how do I look at my health.
Very nice, doctor. You have explained us about the importance of subconscious mind. Now, I would like to ask you that after COVID pandemic, we have seen there is a sudden spurt in the cardiac deaths, whether it is from myocarditis, ventricular fibrillations, or some stroke. A lot of these problems has really accelerated, and people, initially we were aware that only after 50 years or 60 years of age you get mi, but now we have seen in very small age groups also we are seeing this problem is happening, and all of a sudden mi is developing, and 25-year-old child or 20 years old child is suffering from mi. So please give a brief opinion about this sudden deaths.
Well, this has happened. After COVID, the number of deaths have multiplied in every country in the world. There are no two thoughts up to this level. It's only after that people are contesting in various ways. Some says it was the COVID which has increased our morbidity, but to me also the vaccination, I think, is definitely a role to play into this. Till today, we've got so many patients who are they're living into chronic fatigue syndrome, hepatic problem, and the worst that is there is a sudden cardiac death. So today, I do one of the very, very good echocardiogram in the country. I do what is called as a speckle tracking study in every patient that I take for echo. It takes me a long time, but it gives me exactly the condition of the heart. Say today, most of our cardiologists have become stentologists. What do they do? Every patient, little pain, chal, you go for angiography. Once you go for angiography, you will get a few blocks here and there. So then they'll say, press upon you, oh, you have 80% block, 90% block, you won't reach home, you must do angioplasty right now. And people fall a victim to this because of the scare. So what I have never seen them doing a proper echo report. If you do a proper echo study, you put your probe on the heart and start studying every bit out of it with this newer technique of speckle tracking, which is called strain and strain rate technique. We are able to practically study the function of each of these muscle cells. Are they functioning good? What does angiography do? It does only shows you the blockages in the vessels. It does not look at your heart. It doesn't look at how healthy is your myocardium. It does not look at, it does not tell you how healthy is your pericardium as well as endocardium. These are the three layers of the heart. And myocardium is the muscle cell of the heart. Myocyte is the most important cell. What we find on this is I have found lots of cases of inflammation of the muscle cell. That is myocarditis. And I have found this. And what can do? Suppose your cell is inflamed and then I'm feeling weak, but still I want to get strong. I go into the gym. I'm feeling doing some celebration. I keep on dancing. You've seen in Gujarat during that Garba dance, how many people died suddenly of a heart attack. These are the people who die of a ventricular fibrillation because they are inflamed, they have inflamed myocardium. And today, on an echo, we can pick up an inflamed myocardium. Somebody has to do the echo properly. Unfortunately, most of us don't do an echo properly. We just do an echo superficially. Structurally, अच्छा है, तो ठीक है, angiography के लिए जाओ. Because for the whole population in the country, heart disease is equal to blocks. This is a surprising word which should go out of their mind. My patient coming, kitna block hai? That's only word they use. Kitna block hai? Heart problems is not block. Your heart has 1,000 problems. It has all the problems, including cancers inside it. Okay, it has multiple problems, and an echo can help you get almost all these problems if it is done correctly, if it is done nicely. And that's fortunately I do. And I've been able to pick up this myocarditis patient. I have treated them correctly, and these people have recovered. Till today, touch wood, I haven't lost any of the COVID patient or COVID or post COVID myocarditis. I haven't lost. I'm able to save them pretty well. There are ways to save them, and they are saved. Only, only thing, we must pick up that inflammation, because when your muscle is inflamed, you go to do any severe exercise, you can collapse due to ventricular fibrillation. You see them, if somebody is playing, is dancing, and suddenly just collapse. If this was a myocardial infarction, if this was a heart attack, what happens? In heart attack, first there is a blockage, and then the muscle is pain, then the muscle is dead, and then you have various complications. When you develop an heart attack, you don't die just like this. It's very clear that these people suddenly develop that ventricular fibrillation, and they just slide down and they are dead. In fact, if there is one man, somebody next to you at that time who can give you a proper cardiovascular massage, CPR, what we call it, you can easily save these people. You have to understand it at that moment, and you should manage to do this within 2 minutes. Within 2 minutes, we can save them. Even one thumb, a cardiac thumb that we give, have managed to stop this ventricular fibrillation and reset the heart to a normal rhythm. So all these things, the society must be made to be aware of this. A lot of these good things which are available in our hands. I don't need a very sophisticated ICU to save the patient. You can save the patient with your own hands. All that you got to do is learn to do it. Once you have learned to do it, rest is simple. So if you look at it, from you need a huge budget when it comes to personal health. I don't believe into that. We, in a poor country like India, we are no longer poor anyway, okay? But still, we are backward. We are not also backward. But in a country like India, we don't have to spend so much of money doing angiographies and angioplasties and CABGs to save this patient. No. Teach them how to eat properly, teach them how to exercise properly, teach them how to think properly. It is your thought. How does your mind work? You have the thought. We have around 80,000 thoughts a day. When you have one thought coming inside it through your conscious and subconscious mind, your brain converts that thought into those chemicals. When you're happy, there are different chemicals like dopamine, serotonin, and all those things. And when you're unhappy, there are altogether different chemicals like your steroids, corticosteroids, adrenaline, noradrenaline, and so many other things. It is these chemicals which come into your body and have the effect. All these chemicals have the effect. They have their effect, and that effect subsequently gets converted into the effect on the body. So what matters is what you think. If you are able to think correctly, we can definitely go out of the way of falling sick. In fact, one day I think I'm going to categorically prove you think of a disease first and you get a disease later. Today I don't have sufficient evidence to prove that, but I believe it is absolutely true. And if you go with this, it's very easy. If we can teach people how to eat well, how to think well, and how to exercise properly. In fact, how to live a human life. We are just the other way around. We teach each other to kill, to hate, and whatnot. Absolutely the negative thoughts that destroys our body.
Yes, doctor. I just want to ask that corporate hospitals, they are mostly blamed for unnecessary surgeries, investigations, procedures, and investigations. But in your hospital, you are providing the most affordable treatment regimens for your patient. How you are able to manage the cost effectiveness in the treatments like open heart surgeries, valve replacements, mitral valve stenosis, MIs, and the patients who are in the geriatric population, you are running the special clinics for the geriatric cardiology. So please tell us that how you are able to manage the hysterectomy, angioplasty, then cholecystectomy, plastic surgeries, and also today when we in the morning we came at your hospital, we have seen you were doing the knee replacement with your orthopedicians and orthopedic surgeons in a very affordable way. So how you are able to manage the cost effectiveness and how you are able to manage the investigations in a very economical forte.
Well, I've never thought hospital is a place for me just to make, or what I would say, MS money. No, hospital is a place for me to make others healthy. And when you want to make others healthy, there are various ways by you can make them healthy. In fact, if I can avoid a surgery and give relief to somebody, I think most of the time I'm more happy. Obviously, patient has not spent too much of money, and obviously he has not spent too much of trouble, and obviously he has not had too much of risk when you don't operate on him. It's a very simple thing for me. Do not We cannot replace what God has given into our body. We cannot replace that. And if we look at that part of it, okay, we don't nobody has to spend too much of money. And mine is not a corporate hospital. Mine is a nice boutique homely place where you feel at home. There are the people working at home. You feel you're as if inside a family where we do this, even the most complex surgeries, and give you the relief that you need. Yeah, when you need a surgery, you need a surgery. Corporate hospitals are an essential thing because they are huge. They have huge money, they have huge budget. They can do and keep on teaching us better and better surgeries in times to come. We also need to develop. But every developed operation, every developed surgery is not an advanced treatment. First thing, look at the basic human being, treat him, and we not most of the ways we are able to do that. And when he has really spoiled his organ to such a level that we need to interfere on what God has gifted him, we need to interfere. And the boutique hospital doesn't need that much of money. We are able to do it with a much lesser cost. In a corporate hospital, the cost is huge, investments are huge, and there are many other people involved. Here in boutique hospital, I take the total responsibility. Okay, so when I'm there as a central place, all other doctors working with me, we are able to do it at a much lesser cost, and we are able to do it much safely because we are with the patient, and we are able to do it much sophisticated. It's not that. That's a very simple thing. But and simultaneously, if you say that yes, there are corporate hospitals which do take decisions differently. A lot of unnecessary surgeries do happen. A lot of unnecessary investigations do happen. These things happen, but you don't blame that corporate hospital. It has to run that way. It has to, because there is nobody to run it. There is a company to run it. Company doesn't know anything about health. Company has put its money inside it, and company wants its money back. It's a business sense. You can't blame that. So they find all sorts of their tactics to recover the cost that they have put in, because they have put in money. In our case, what happens? We have put in much lesser money. Few doctors come together, put in little bit of money, and then grow it with their efforts. The amount of efforts that I take at the age of 66. Today I began my day at 4 o'clock. It's 9:30 now. I'm running. I'm enjoying my medical practice.
Thank you, doctor. So he's Dr. Digambar Naik, who is a pioneer in the modern healthcare system, who had seen a paradigm shift from the primitive Goa to the most modernized
I think that is supply. Yes, supply.